After your operation, you will be taken to the recovery area where you will be monitored until you have woken up. You will then be taken back to your ward for an overnight stay.
From the patient's point of view, the most important thing is that immediately after surgery they will have the eye padded or both eyes padded. In other words, 12 hours stuck with really requiring nursing care, 8 to 12 hours, just the overnight period. Most people don't find that much trouble because they're often a bit sleepy after the surgery, they have some analgesia and so on. And following morning they'll be unwrapped, there'll be some drains, some plastic drains that just reduce the tendency to bruising. They come out the following morning. In terms of pain, most patients don't really find it any significant problem. Most patients will not use more than paracetamol, if that. It's not an area with a lot of pain. They'll know they've had surgery because of a bit of puffiness, but we give various medications that reduce the puffiness and thereby reduce the pain. So most patients aren't that troubled and they'll be able to get up round, wash normally, have showers and so on. Really not a problem.
The following day, after the doctor has checked the condition of your eyes, you will be allowed to go home to recuperate. The ward nurse will give you any medication you need before your next visit to outpatients. How much trauma can you expect from the operation?
It varies between different people. Some people will have a fair amount of swelling, puffiness and swelling. It's some of the thinnest skin in the body, so it puffs up easily. And that tends to reach a maximum at about the second post-operative day because they haven't had the pressure on that they've had for the first post-operative night.
And it is well documented that thyroid patients take a lot longer to get rid of their swelling than patients who've not had thyroid eye disease, owing to the fact that their lymphatic drainage has been damaged. So patients are always warned that they're going to take several weeks, sometimes several months, for the swelling to go down, if indeed it all goes down 100%. So simple measures like having the bed tilted up a little bit or sleeping on more pillows if you don't sleep on any pillows at all, that sort of thing would help. Ice cold compresses, whether it's frozen peas or a formal iPad, doesn't matter, 3 or 4 times a day to encourage the swelling to go down. All measures that are really used for anything else or anywhere else in the body, you can use on the lids judiciously.
They should avoid heavy lifting, pumping iron and so on, probably for about 2 weeks. But otherwise, if their work involves telling people what to do or VDU work, and they're perfectly happy to do it, they will not have any harm by doing that sort of work.
If you have any questions about how much exercise you can take or when to return to work, you should discuss this with your doctor at Moorfields or your general practitioner or GP. Before you leave, a follow-up appointment will be made for you to return to outpatients to remove your stitches and check on your recovery.
On the first post-operative visit, which is usually 1 week after the surgery, the patient is seen by a nurse first, followed by a doctor. The nurse will ask the patients about all experiences which patient had during the surgery, and if the patient has any concern regarding the surgery. The nurse will check visual acuity and color vision. All findings are documented and passed on to the doctors.
The nurse will then prepare to remove your stitches.
Of course, first we look at the wounds, if they healed properly and if there is no any signs of infections. Then the nurse will remove the stitches. After removal of stitches, usually the scars are properly healed, so the patient will be able to wash face as normal using soap and water, but sometimes the scars can be slightly crusty, so we can advise the patients to use some cotton wool pads soaked in a boiled cooled water and wipe gently lateral canthal area, which is on the outside corner of the eye.
The nurse can also apply ointment or lubricating drops if you have any discomfort or dryness around your eyes. If necessary, she can also supply these for you to take home to use.
If the patients, they've got any problems with instilling the drops, the nurse can help to teach the patients a proper technique, how to use the drops and ointment. It is very important to follow the nurse instructions because it will speed up the healing process and it will prevent any infections.
Over the following weeks, you will be seen again as an outpatient to monitor the results of your surgery and assess if any further treatment might help your condition.